und so nichts, weil da war nichts.
Doing?
Okay, how are you?
I'm doing pretty fine. We are here in zum Hall, in the Hell. This is the cafe where the TCM therapists hang out after a hard day work at the Congress. You just told me that the last 1.5 days you have lectured on different subjects, and yesterday you talked about
Yamamoto scalp acupuncture for pain and neurological disorders.
Okay, and can you explain a little bit how that work, or how that
the lecture or the technique, the method?
both, just what you want to share.
Basically, the method is a development of the Chinese scalp acupuncture, of a microsystem that was discovered by Dr. Toshikatsu Yamamoto, a Japanese physician who discovered other points to treat neurological disorders and pain.
Okay.
And it's located on the scalp, just like a little microsystem.
Can you tell me a little bit more about that? Because we know some scalp points, but I assume that these...
different than the Chinese scalp acupuncture, where the points correspond with the areas of the brain, this is a method that they not necessarily correspond with the areas of the brain, and that you also have, which the advantage is, you have diagnostic points throughout the body, which allows you to choose the correct points, or to even know that you've needled the correct point in a precise manner, which is different than the Chinese scalp acupuncture, where you actually, just according to the symptoms, if they improve it or not, you see if you're in the correct areas and zones.
So you use body points to determine
The diagnosis are in the abdomen, the elbow, or the neck.
And then eventually you kind of puncture in the scalp, but
Yes.
not necessarily on corresponding like motor or
sensory cortex.
Yeah, exactly.
Yes.
Okay. So that was yesterday, and today you had a different
Today
topic.
I spoke about the same Yamamoto scalp acupuncture for for rehabilitation and balance and walking disorders.
And what are the chances of recovery after somebody had like a stroke?
Today I believe, or even Dr. Yamamoto believes, that he always says if you study till the level of the library, you got to go out of the library and you can succeed. Any paralysis or any pain can disappear. Basically, he's saying that today, if you continue to try, you can treat any disorder. And from my experience, we've seen in research also that we're doing in the hospital that I work on, we've seen improvement with the system, and even by 20%, 25% on patients, that the outcome, which are estimated to come up, they're coming out in a better situation, in a better manner, and in a faster manner.
And some people also fully recover?
It depends how damaged they are, and in the end it turns out how much time they can come and continue to the acupuncture. But the belief is that if you do a multidisciplinary treatment with combining acupuncture, physiotherapy, occupational therapy, they'll have a better outcome. And some of them even, there's amazing stories of people that they said they'll never walk and today they walk, not necessarily. This is like got to do with the neuroplasticity that they're speaking about today more and more in modern medicine.
And where is it that you practice?
I practice in Haifa in Israel. I have a clinic where it's called Pnima, and at the same time I practice in a rehabilitation department in one of the medical centers, hospitals in Haifa as well, called Bnei Zion Hospital.
Now today I had myself a lecture by Jahir, I've got his last name, also from Israel. Also telling me that they do a lot in hospitals, and that hospitals are referring in some cases to the acupuncturist.
Yes, you see it more and more.
So is that a new development, or?
I think they've started seeing the advantages of acupuncture. So more and more in the hospitals, you see more and more referrals to using acupuncture. Like in the department I'm working in, the rehabilitation, all the refers all the time, the occupational therapists or the physiotherapists are recommending the patients to receive at the same time acupuncture, and it's part of their rehabilitation, so they don't even pay for the treatment. It's part of their intake in the hospital. They receive it, so it's part of the rehabilitation.
How does the payment goes in Israel? Are your treatments covered by the insurance company, or
some people have private insurance, and then it's covered by private insurance.
Okay.
But all of the governmental insurance have some kind of acupuncture in it, that costs a bit more, and it's subsidized to a certain amount of.
And it is, but it's probably limited as well.
Yes, to a certain
amount.
amount of treatments a year.
Yeah. Okay. Well, thank you very much for
You're
all
welcome.
this information. Okay, let's go back and have a beer.